Okay, let's get started here. It's my pleasure to introduce Daniel Webster. I had mentioned earlier in the program that Daniel is the co-director of the Johns Hopkins Center for Gun Policy and Research, and also the associate director of the Center for Prevention of Youth Violence at Johns Hopkins. He's been a core member of the Johns Hopkins Center for Injury Research and Policy Center since 1992, and he's published articles on firearm policy, youth gun acquisition and carrying, the prevention of gun violence, intimate partner violence, and adolescent violence prevention. But he brings a wealth of experience in evaluating different types of violence prevention interventions, ranging from firearm policies to community programs to change social norms, to public education and advocacy campaigns, and also school-based curricula. But I don't know if any of you were able to see the Johns Hopkins Gun Policy Summit last week that Daniel organized along with Jan Vernick, his colleague. But it was a superb meeting on evidence around firearm policy. And you can find that on the Hopkins website if you're interested in looking at it. It was really a very excellent meeting. So with that, let me give the podium to Daniel.
Thank you, Jim. When the planning committee was putting this together, this was not an easy thing to do. So hats off to my fellow committee members and the staff. We felt it was important to. Since we're going to be hearing about a lot of evidence-based programs throughout today and tomorrow, and it seems as though most of the evidence that sort of is rated at the highest level, most commonly is targeted at individuals because it's far more practical and doable to do randomized experiments with individuals. But since we have a public health orientation to this problem, of course, we can examine and address this problem at many different levels. So we felt it was important to spend a little bit of time thinking about evidence around more aggregate-oriented interventions. Those interventions could be delivered at a community level, a city level, state, or even nationally looking at policy. So Mark volunteered me to do this. So of course, the area that I do most of my work in is on gun violence. So I'm going to give some examples on gun policy that, but the general point, of course, I hope you learned something about gun violence and its prevention through my talk. But really, the bigger point that I want to convey with this is some of the unique challenges to doing studies of this nature, of policy or community-based interventions, and what you should be looking for as you evaluate evidence. Okay. So as I indicated, random assignment typically is not possible. Occasionally that can be done at a city level. I always tip my hat to colleagues who are able to convince. Often this occurs at a city level where they can do randomize police precincts or other neighborhoods to look at different intervention strategies. But more commonly, policymakers don't think like scientists, and maybe to their credit, they simply want to implement the program where they think it's needed, right? And that's what happens on an everyday basis. So in that context, the scientists who try to develop the evidence are going to be trying to look at change over time where the intervention occurred, and then try to find some reasonable comparison groups. And this idea of a difference in difference. You look at a difference before and after an intervention, and the difference between that before-after change in places that didn't get the intervention. That's sort of the very basic and I hope intuitive sort of approach to how you develop evidence on program efficacy. But what I want to convey is sort of the key, what I think are the most important things to reducing bias, because when you're out of the randomized control design, there are a host of potential biases that could affect your findings. I think the most important things to think about is how similar are the comparison groups. And more is not necessarily better. So there's a tradition in looking at particularly policy interventions, whether this is at a state level or a city level, county level, where researchers, there's a lot of data available. You know, I can go to the Uniform Crime Reports, the FBI, and I can get data for a whole lot of cities, a whole lot of counties and states, and you know, the more is the better. But I actually think that sort of thinking has really led us astray and got us away from what I think is sort of really common sense. So if we're setting up a randomized design at an individual level, and this intervention is one that you're going to implement in schools, say, to reduce bullying. And so you have an intervention, someone's already, that's out of your control. They've put it into place in inner city Baltimore. Okay? So I could try to get comparisons for schools all around the country, right? Because more is better. But that really wouldn't make sense, would it? You would think that if I want to assess treatment effects, that I need to find something that is comparable and most similar to inner city Baltimore. Very basic. But if you look at the research on many different aggregate level studies, that's missing, and I think that's why we get a lot of biases. So I think that it's important not only in terms of similarities. So one way you can think about similarities is for the problem that you're studying. Let's say, again, let's use bullying for an example. What's the baseline rate in your intervention school versus your non-intervention school? If it's quite different, you have to worry. And a lot of researchers say, well, I have 42 covariates to control for all of these differences. Be skeptical. Usually our covariates aren't nearly as good as we hope they are. And so you not only want them to be similar at baseline, but you also hope that they're on similar trajectories, right? So if you're looking at a problem of bullying in one place that seems to be rapidly getting a lot worse, and that's why they said, you know what, we're going to put a bullying prevention program in this particular school. And then you look at comparison schools where maybe it's not changing at all or going down. Again, you have a huge potential for bias. And then finally, the key thing is try to identify and control for the key confounders. But in violence, particularly at the aggregate level, where you're relying heavily upon surveillance data, because you need this longitudinal historical perspective, and you won't have had the ability to do your own surveys where you get your own specific measures. So you have to think about what's changing over time and how you use most creative procedures to try to control for those things that change over time. So I want to give an example, what I consider to be a particularly good example of, first, flaws and problems that people have run into in evaluating gun policies, and then sort of some examples that sort of say, this seems like a more productive way to do it. So one of the most contentious gun policies, really, there's actually a fair amount of consensus, believe it or not, about a whole bunch of gun policies. But there's some that are not. Assault weapons is one of those with less consensus. But maybe the most contentious is the whole idea of concealed carry and the so-called right to carry policies. So an economist named John Lott did some of the first research to look at the effects of these policies that, if you're not familiar with them, the very basic way to describe them is that for individuals who can legally possess guns, they're not disqualified because of being a felon or any of the other exclusions. The state, if you apply for a permit to carry a concealed firearm, they shall issue you that permit unless they have, you didn't meet some qualification. So John Lott published some of the first research looking at the effects of these policies, and he did so in the late 1990s. I should have had a slide to sort of summarize his findings, but Lott generated a lot of data that indicated that when states pass these laws, they experience pretty significant reductions in violent crime in response. This created a bit of uproar, not only just in the policy world, but in the scientific world, because people were really scratching their heads of how could this be, because it didn't line up with a lot of what we knew about gun violence, and I won't get into all the particulars about that. But a series of research, the good thing about the John Lott research is that it spawned a whole lot more research. People wanted to see, could you replicate this? Are there flaws and problems in the research that are causing potential bias? So basically, this research found some of the following issues. And it gets down to the issues I was raising initially, that the states that had passed these laws were quite different from the states that weren't passing these laws in important ways that influence not only their level of violence, but their trajectories of violence over time that they were experiencing. I'll show you a graph in just a moment, but the early adopters, one of the states that first started to adopt these laws, did so following a spike in homicides that occurred in the early 1980s. Now, typically, if anybody has studied gun violence in particular, gun violence tends to often have cyclical patterns to it. And almost anything that you implement when the problem is at its worst, you can look really good on the downside, okay? And that's more or less what happened with respect to these early adopting right to carry, so-called right to carry laws. So some of this drop that would have occurred sort of naturally in sort of a regression to the mean kind of phenomenon was attributed to the law incorrectly. Secondly, the most important confounder that was driving rates of homicide and gun violence during the period of study was the so-called crack cocaine epidemic that started in roughly 1986. That varied a little bit, and this is important. When its onset varied a little bit over time and how quickly it dissipated, but it generally covered the years 1986 to 1994, a pretty large section of time when there was a lot of policy change. And again, this epidemic was not affecting all states equally because, frankly, it was largely a urban inner city phenomenon. And states that had more of that kind of population felt that violence, its increase and subsequent decrease, more so than states that were less urban. I recognize this is going to be difficult to follow, but just for briefly, the darkest line with the rectangular indicators for each year, that is the early adopters of these right to carry laws. And you can see, as I was saying before, a sharp increase in homicides during the early 1980s, right before these laws started to be adopted in the years 85 to 88. Again, I won't go through each of these trajectories, but even though there's some similarities, there's also some striking differences of when and how the drug market related violence affected these trajectories. So there are some rather very basic flaws and problems that occurred with John Lott's research. I'm now jumping ahead to the third bullet. I should put it first, but they found just errors that were made in coding which state had which law in what year, as well as other problems with the crime-related data. And when Ian Ayres and John Donoghue, a set of economists who I think most rigorously have re-examined this policy and its effects, when they corrected for the problems with those errors, all the effects of the laws went away. But there were other problems with the research that I think are instructive as well. Again, Lott sort of went with the approach more is better, with a whole lot of covariates that were highly collinear, did not necessarily add much to a modeling perspective, and actually can be harmful, but omitted what many believe to be some of the most important drivers of changes in violent crime, and that was changes in rates of incarceration, which were changing quite substantially over the time period of study, as well as policing variables as well. There were other problems simply on a statistical level of not controlling for clustered data. So the best study that I think tries to correct for these is one by Engia, I'm not sure I'm pronouncing the name correctly, Donoghue and Zhang, published in 2011. And what they try to do is use more flexible modeling to try to address some of the differences and trends over time along the lines that to address the problems in the graph that I showed. So the important lesson from this is there was a lot of research generated, and that evidence was used to really affect policy. John Lott went to state capitals around the country to trumpet his findings, and many of the proponents of these laws used that research quite successfully. We now, I think 42 of 50 states have these right to carry laws. And their laws are being pushed at the federal level too to recognize these permits across state lines. If you look at this, again, this what I consider to be the best study to examine this, you see there's a number of models to look at this. Generally, you see either no effect, pretty much no effect across the board from these policies, but some evidence of small increases in aggravated assaults, which is exactly the type of crime that you would worry might increase as a response, simply because more people are carrying guns, these more spontaneous events. Someone might pull out a gun when they get upset if they get cut off in traffic or in various contexts. And even though as a percentage, that's quite low, of course, it's the most common form of violent crime that we track. And so this actually adds up to a whole lot of incidences of gun assaults, if indeed these estimates are true. So very briefly, I'm going to try to show you a little different approach, less ambitious. I wasn't trying to explain everything across every state with respect to these policies. We studied the effects of a ban of Saturday night special handguns in Maryland. These are type of weapons that are very poorly made, fit in the palm of your hand, and tend to be overrepresented in crime, probably in a combination because of their low price as well as their easy concealability. Our approach to studying the impacts of this law was to not compare Maryland with every single state. We didn't necessarily think that comparing changes going on in Maryland with North Dakota or Montana or Hawaii would necessarily tell us a heck of a lot about what would have happened in a counterfactual had Maryland not implemented the law. So what we did is we looked at which states seem to be trending and tracking prior to this policy in Maryland most closely. And perhaps logically, the states that did trend in similar ways to Maryland were the ones that it bordered on, Virginia and Pennsylvania. So we used a combination of ARIMA modeling that basically is trying to model an outcome based upon its prior cycles and patterns, as well as outcomes from neighboring areas to model change over time. And this is simply a graph. The graph shows you the dark line is what was observed for gun homicides in Maryland. The vertical line is when the law went into place, and the predicted is the dotted line, and the difference there is, in essence, the policy effect. But the main thing I want to point out really is that how well the predicted and observed lines track one another prior to the law's intervention. And that's really what you want to look for when you look at studies of this type. Was the statistical model accurately predicting the outcome prior to the intervention? If it wasn't, then you're almost certainly going to have bias. Okay. Now I'm going to talk briefly about some neighborhood level interventions. This is a study, I'm going to talk about a study that we did in Baltimore to evaluate the effects of Safe Streets program, which was modeled after a somewhat widely known program in Chicago that had been called Ceasefire, now is called Cure Violence. There was a prior study that that used similar techniques that I just shared with you, looking at Maryland's Saturday Night Special Ban law, but looked at the neighborhood level to look at changes in gun violence in the intervention neighborhoods versus comparison neighborhoods. So the general model had to do with outreach to the high-risk individuals, developing trust with those individuals, using violence interruption and conflict mediation is really the most immediate and key thing that's going to hopefully drive down gun violence. The prior evaluation showed that there were program-related reductions in 4 of the 7 intervention communities examined that ranged in magnitude from 16% reductions in shootings to 34% reduction. So we wanted to try to, again, replicate to see. There was a big question. Yes, it worked in Chicago, but it was really designed for Chicago, very much so. There are some similarities with urban violence across cities, but there are also some distinct differences, particularly as it relates to gangs that are generating a lot of the violence. And gangs in Baltimore look a heck of a lot different than they do in Chicago. So I, for one, even though I tend to be an optimistic person, was skeptical whether this could work in Baltimore. So we looked at the program effects in 4 neighborhoods. There was one neighborhood in which basically program implementation failed. And so we dropped that site from the model. We looked at implementation periods that ranged from 18 to 40 months. These were put into place at different times. And recognized that there were some, even though they all got similar resources and training and were generally following the same playbook, there were some differences. In 3 of the sites were clustered in East Baltimore, and did not necessarily, in some ways, they were trying to economize with economies of scale, and so not all sites got the same amount of resources. So briefly, what we did is we looked at changes over time in 2 measures of gun violence, homicides and non-fatal shootings. And rather than look at every single police post in Baltimore, we only looked at the top quartile at the baseline levels of violence because, again, we didn't think it was going to be particularly useful to have very dissimilar comparison groups. And conveniently, it was that top quartile that was eligible for receiving the program funds. So the way this worked is community groups applied to the city of Baltimore to the health department to implement this program. And you had to be in that top quartile in order to get funding. So we used some regression modeling that accounted for clustering of the data, and we controlled for other things that were going on that we thought could conceivably affect these trajectories of gun violence over time. These principally were law enforcement types of interventions. The number of drug arrests was changing quite substantially over the time period, as were weapon arrests. There was a particular unit that was deployed specifically to address gun violence, the Violent Crime Impact Section, they're called. They also did implement a program called Project Exile that some may be familiar with. It started in Richmond. And then we recognized that we wanted to control simply for month because there was seasonality in gun violence as well. So this is a somewhat busy slide. I apologize, but we did not assume that the program would have similar effect across all sites for some of the reasons that I indicated before. And so I'll very briefly talk about the four neighborhoods: McElderry Park, Elwood Park, and Madison East End, all clustered on the east side. We found that McElderry Park was the first site that implemented, and were really quite successful. They went for 2 years without a homicide following program implementation, and that just simply had never happened in time that they've been measuring violence. But when these other sites came on board that they also had to tend to, it sort of dissipated their energies. And so we looked at effects before and after these other sites were added, and the effects were less so for homicides. Not statistically significant when these other sites were on board, but 50% reduction when they weren't operating. Cherry Hill in South Baltimore, 56% reduction. We also looked to see whether gun violence was changing in neighboring areas, because if gun violence operates as a contagion, hopefully you can even prevent violence outside the main intervention area. We did see some evidence of that in Cherry Hill for homicides. Looking at the outcome of non-fatal violence, we saw that in 3 of the 4 sites you did have significant reductions in non-fatal shootings. And in 2 of those intervention sites, you also had beneficial spillover effects. I should have also said, and maybe you're waiting for me to talk about that, 170% increase in Madison East End. So that was over an 18-month period for a pretty rare outcome. So you can get some pretty large change in a short amount of time for a rare outcome if you have some bad luck. There's a larger story behind that I don't really have time to get into now. But suffice to say, I don't have any reason to believe that the program instigated those homicides. We found that the thing that distinguished the sites with the greatest reductions in homicides from those that didn't were big differences in the red bar, which is the number of mediations. They had similar levels of staffing, working outreach, but very big differences, threefold differences in the number of mediations that they were doing. And if you looked at the qualitative aspect of those mediations, here's some of the risk factors of individuals involved in these mediations. You see a whole host of things, danger signs there basically, and if you can successfully interrupt these set of this constellation of risk factors, you have the potential to save lives in homicides. I'm getting close in my time to just, I mentioned the potential harmful effect there. There were other initiatives launched during this time, but they were not neighborhood-based, so I'm not as concerned about them biasing our findings. We did find that even among that top tier of top quartile of police posts, the intervention sites were even more violent. And so when we took out some of the lesser violent comparisons, our estimates of program impact were basically the same. So that was reassuring. And then a problem, the last point I'll make here is a problem that happens in a lot of quasi-experimental research is selection bias. what was unique about these neighborhoods, that why they got this intervention? Were they particularly resourceful and they would have figured this out on their own and it wasn't really the program? In the case of our evaluation, I don't think that's a problem, because 3 of the 4 sites were actually, the community group doing the intervention did not even apply to work in those neighborhoods. The city said, we really like you, but we want to take you into a more difficult area. So it wasn't anything special about the neighborhoods that got 3 of the 4 interventions, and why they got the intervention. It was not a selection effect on the part of the interveners that made them more motivated to address gun violence.